Hello, I'm Dr. Emma Hitt-Nichols, and this is the new FDA Approvals Podcast. This is the information on the latest US FDA approvals for last week. That was July 24th through the 28th, 2023. And I'm going to start summarizing things very quickly up front and then go into them in more detail so that you can decide whether you want to keep listening. I hope you do. So this week we have RiVive receiving over-the-counter approval for opioid overdose. We have Balfaxar, which is for urgent reversal of warfarin or other VKA therapy. We have Xdemvy, which is used now for a common eyelid condition, which is known as Demodex blepharitis. And then also this week, I'll start talking about upcoming approvals, the PDUFA scheduled dates for this upcoming week. We have it for Remestemcel-L, for acute GVHD, and zuranolone for major depressive disorder and postpartum depression. All right, first up this week, we have RiVive, R-I-V-I-V-E, over-the-counter approval for opioid overdose. The FDA has approved RiVive, a 3 milligram naloxone hydrochloride nasal spray for over-the-counter use in emergency treatment of known or suspected opioid overdose. The FDA granted the non-prescription approval of RiVive to the manufacturer Harm Reduction Therapeutics. RiVive rapidly reverses or blocks the effects of opioids, restoring normal respiration, especially when given within minutes of the first signs of an overdose. This week's approval marks the second non-prescription naloxone product, the other being Narcan, manufactured by Emergent Biosolutions, and that was approved for over-the-counter use on March 29th of this year. Overdose remains a significant public health concern in the United States, particularly with respect to synthetic opioids such as illicit fentanyl, with more than 105,000 reported fatal overdoses occurring in the 12-month period ending in February 2023. Naloxone rapidly reverses opioid overdose effects. The approval of RiVive for non-prescription use was supported by data demonstrating its effectiveness and safety, as well as consumers' ability to use it correctly without the supervision of a healthcare professional, although RiVive may cause severe opioid withdrawal symptoms in individuals dependent on opioids. Also last week, the FDA approved Balfaxar, which is prothrombin complex concentrate, human LANS, and that's used for urgent reversal of acquired coagulation factor deficiency, induced vitamin K antagonist therapy, such as warfarin, in adult patients requiring urgent surgery or invasive procedures. Balfaxar, which is manufactured by Octapharma USA, replenishes deficient clotting factors caused by warfarin therapy or other VKAs, and is a non-activated 4-factor prothrombin complex concentrate. That's 4-FPCC, and that contains vitamin K-dependent factors. The approval was supported by the LEX 209 clinical trial, which demonstrated this agent's hemostatic efficacy and non-inferiority compared to a comparator, Kcentra. Over 2.4 million patients are prescribed warfarin each year in the U.S., which increases bleeding risk during urgent medical procedures and may require hemostatic treatments such as Balfaxar. The prescribing information for Balfaxar includes a boxed warning for risk of thromboembolic events, especially in patients with a history of those. Is your company in need of medical writing assistance? Go ahead and visit our website at nascentmc.com. That's nascentmc.com. Our native English-speaking MD and PhD level medical writers create fast turnaround needs assessments, medical news pieces, manuscripts, slide decks, ad board summaries, and much, much more. We're here so that you never have to be without excellent medical writing help. That's nascentmc.com. The FDA has also approved Xdemvy, which is also called lotilaner ophthalmic solution, 0.25%, and that's developed by Tarsus Pharmaceuticals, and it's the first treatment for Demodex blepharitis. Demodex blepharitis is a common eyelid disease affecting about 25 million people in the US. The condition is often misdiagnosed or underdiagnosed and is characterized by redness, inflammation, and missing or misdirected eyelashes. Also includes itching along the eyelid base and the presence of waxy debris, waste products found at the base of the eyelashes. Those are called collarettes. Xdemvy directly targets inflammation caused by the Demodex mites, and those are microscopic parasites living in hair follicles and oil glands. And apparently almost everyone has these mites. That's a nice thought, but they usually don't cause problems. However, they can proliferate in people who are immunocompromised or have other skin conditions. Xdemvy is administered as a single drop in each eye twice daily for 6 weeks and eradicates the mites. Clinical trials demonstrated the efficacy of Xdemvy with patients experiencing extreme improvement within 2 weeks. Many patients, sorry. The treatment was generally safe and well tolerated, with common ocular adverse reactions being eye stinging and burning in about 10% of patients. Xdemvy will be available by the end of August 2023. And also in this podcast, I wanted to start including upcoming PDUFA dates. We have a couple of them that's expected approvals. So just in case you're not familiar with the term PDUFA, that is the FDA Prescription Drug User Fee Act PDUFA date. And that's the target deadline from the FDA for it to complete its review of a new drug application or biologics license application submitted by a pharmaceutical company. So we have 2 PDUFA dates this week. We have Remestemcel-L, which is being developed for inflammatory diseases in children and adults, including the treatment of acute graft versus host disease. And that's a potentially life-threatening complication of allogeneic bone marrow transplant. And Remestemcel-L has a PDUFA date of Wednesday, August 2nd of this coming week, according to a press release from the manufacturer, Mesoblast. Currently, there are no products approved in the United States for the treatment of steroid refractory acute GVHD in children under 12, and off-label options have demonstrated mixed efficacy with high toxicity. Remestemcel-L is derived from culture-expanded mesenchymal stromal cells from donor bone marrow and is thought to counteract cytokine storms that can occur with allogeneic bone marrow transplant. The FDA issued a complete response letter to Mesoblast in October 2020, requesting additional data from at least one randomized controlled study in adult and or pediatric patients with steroid refractory acute graft versus host disease. Another expected approval this week is for zuranolone, which is set for this Saturday, August 5th, 2023, after the NDA was accepted for priority review in February of this year. Zuranolone, also called Sage 217, is manufactured by Biogen Inc. and Sage Therapeutics and is a potential treatment for major depressive disorder and postpartum depression. Zuranolone has been assessed as a once-daily 14-day oral regimen in adults with MDD or PDD. The new drug application includes data from the NEST and Landscape clinical development programs and a phase 2 study from Japan. Zuranolone is a neuroactive steroid and has a novel mechanism of action as a positive allosteric modulator of GABA-A receptors. In people with depression, zuranolone is thought to work by rapidly rebalancing dysregulated neuronal networks to help reset brain function. So just to clarify again, those are upcoming approvals. They haven't been approved yet, and that is for Remestemcel-L and zuranolone. All right, that's it for this week. Did you know you can access our nascentmc.com/podcast page and search the summarized notes from this podcast? And if you're writing something up about a therapeutic area, if you search a term, like for instance, diabetes, it will bring up all the diabetes-related therapeutic agents approved since the first episode of May 15th of this year. So the longer this goes on, the more helpful that will be. We're also including the prescribing information with each summary, so that will hopefully be helpful to you. Check it out at nascentmc.com/ podcast. That's it for this week. I hope you have a wonderful week, and I will hopefully talk to you next Monday. Thanks so much.